Hello and welcome to today's training session, which is on Interpod products. My name is Louise Fisher and I am a podiatrist who has lots of experience in using Interpod product devices. The property that we cover today and the content, the materials are all property and therefore subject to this disclaimer. So if you are taking any photos or recordings of this, just be mindful of the rights of property ownership. The plan for today's training session is to go through a clinical reasoning guide for how to use orthotic prescriptions and how to use the Interpod product range. We will cover an overview of the Interpod orthotic range and why you may select one over the other. And we will also explain some of the expectations of you as a prescriber of Interpod products, as well as what the user of an Interpod product might experience or might ask. So we'll start with what is an orthosis. Well, an orthosis is an appliance to support, align, correct deformity or motion of parts of the body. And you can get orthosis of any body part really, but when we talk about Interpod, we're very much talking about our foot orthosis. So a support for the foot to either support, align, correct deformity or motion around the foot, ankle and lower limb. When we think about some of the theories as to what foot orthosis do, we can explore subtalar joint neutral theory, which was one of the first theories around foot orthosis prescriptions. And this was of the belief that if we used a foot orthosis, it would be used to straighten the heel and create a bisection of the heel that was neutral and therefore would be effective. And you can see by these images that the indication under subtalar joint neutral theory was that by putting a foot orthosis onto the foot, it would realign and re-straighten and re-correct the postural anatomy of the foot, the knee, the hip, and you can see further up the chain. Now, subtalar joint neutral theory has been subject to some criticism, and at this moment in time, it is no longer an appropriate rationale for the use of foot orthosis. So what that means is that we should not necessarily be prescribing foot orthoses mainly to make the foot or the heel look straighter, because they don't work in that way. Here's some evidence to explore in relation to that point made recently. The fact that subtalar joint neutral theory, it doesn't correlate to clinical assessment and foot function. Therefore, if we use foot orthosis to put a foot in a straight position, we don't necessarily get or will achieve the benefits that we once thought we would. So as it stands, these papers published in 2017 and 2018, you can see that the clinical rationale to provide foot orthosis based on subtalar joint neutral is no longer appropriate. So what do you use? What theories, what concepts are available in order to justify your rationale for prescribing an Interpod orthotic? Well, we've got a mixture of current theories that exist. The first is tissue stress theory. The second is sagittal plane theory. And the third is subtalar joint equilibrium theory. I'll touch on these theories briefly at this moment in time. So tissue stress theory is the concept of load. It's about identifying what particular tissue is under load, what type of load and what type of stress is under that tissue. And ultimately, if you can identify that, you can decide what it is that you're trying to achieve with your Interpod orthotic, and therefore achieve a clinical outcome. So the general principle of tissue stress theory is to use foot orthosis to manipulate, shift, alter, or change the timing of certain loads through gait and through certain structures. We also have sagittal plane theory, and the concept behind this is in relation to the rocker system. So moving in a forward progression from initial contact into mid stance into propulsion. And the concept of sagittal plane theory is that in order to progress forward efficiently, we need to have sufficient functionality through our ankle joint and through our big toe joint, and often through the hip joint here as well. So understanding how the sagittal plane functionality is working or not, maybe it's blocked, maybe it's limited, that would be an indicator to consider whether you do or do not need to prescribe Interpod orthotic and what impact that then may have on the sagittal plane function of that person. The third theory on this slide is subtalar joint equilibrium theory. You may also hear of this as subtalar joint equilibrium rotational theory. And this is a theory which helps us understand why and how the forces work in particular feet or in particular people. So the idea behind this theory is that we know that every joint has an axis point, and an axis point is a point of rotation. And ultimately, where you get a sweet spot of force and load and counteracting forces, you don't get movement. They're balanced and they're equal. But when you get a difference between a load being applied on one side of an axis and a load being applied on the other side of the axis, we start to get rotation. And this theory helps us to understand how and why some feet will create more momentum or more motion during phases of gait or during contact with ground reaction force. And by understanding subtalar joint equilibrium theory, it helps us to understand what are we trying to achieve with our foot orthosis, and therefore we can select the most appropriate product from the Interpod range to help support our clinical outcomes and our clinical goals. So these are three theories that are current theories of understanding foot function paradigms, how the foot works, how the foot moves, and how orthosis might influence that. And these are all a modern day understanding compared to subtalar joint theory, which is no longer an appropriate rationale. But there are also some other paradigms, and the three that I've just mentioned all come under the concept of kinematic paradigms. And what that means is all of those three previous theories are of the belief and the understanding around movement and motion. So the understanding is that when we use foot orthosis, we are controlling or influencing or manipulating movement and motion of the foot, ankle, and lower limb during gait. But there are two other paradigms that foot orthosis can be used under. So if you think about the Interpod product range, you can also use the product range under a concept of shock attenuation. And that ultimately means that you're providing impact control, shock absorbency, cushioning, and that may be your sole rationale for prescribing an Interpod product, and that is absolutely suitable. The third paradigm is under the lens of neuromotor control. And this is slightly more detailed beyond just a solely biomechanical model, because what the neuromotor control paradigms understand and explore is the perception of what's underfoot. How do you change your perception or your feeling by using different materials or different insoles underfoot? And we all know that experience if we've tried different shoes on in shops. Some feel different than others, and we get this feedback from the nerves on the soles of our feet. This is the lens of neuromotor control, and Interpod product range can be used under this lens as well. So it can be used to increase stability or enhance the perception of stability, or the perception of feeling more stable or more grounded. There is a lot of biopsychosocial components to supplying, prescribing, and using foot orthosis. And within that, you can see these three different paradigms which all come to the front. It could be kinematic, it could be in relation to shock attenuation, or it could simply be to do with neuromotor control, or it might be a combination of all three. So if we look at the evidence, these are two papers that I would recommend for further reading. The first paper is an interesting exploration, which explores what do we actually know about foot orthosis and gait. It's a systematic review and a meta-analysis, really on gathering a comprehensive library of what our current knowledge to date is on how things work in relation to gait and foot orthosis. And what we once understood and what we know now is very different. So if you're not fully sure as why should I prescribe an Interpod, why should I prescribe a foot orthosis, I would recommend that you explore this paper. If you feel like you want to explore something under a slightly different lens, the second paper quoted here, Chasing Footprints in Time, really looks more at a development of human foot function. So obviously, as science has evolved, our understanding of the human foot has evolved. And this paper really goes back to our very, very early understanding of walking and bipedal gaits, and how the science has really shaped our understanding and our beliefs around how this now is, what we understand about it, and therefore how we try and treat it. So it's some interesting reading. We're now going to go on to some clinical assessments that you can use to help guide your prescription of Interpod foot orthosis. I'll introduce you to the Keystone device, and this is a device that is a supination, that can be used, for the supination resistance test. It is also a device that can be used for the first MTPJ dorsiflexion resistance test also. Now, the idea behind the Keystone device is that it's used to determine the minimum level of orthotic support that you may need to be effective. It's a data-driven tool, so it removes the guesswork. It uses technology and readings to give you an objective measure as to how much force is required to support that foot, or how much force is required to create a dorsiflexion moment at the first MTPJ. And you can then translate these clinical assessment findings to help you prescribe the most appropriate Interpod foot orthosis. So the Keystone was originally developed in relation to the supination resistance test, and we'll touch on that on the next slide. But it correlates to a specific range within the Interpod product, which is the Flex range. And you can see here a connection between the low, moderate, and high readings, which range from less than 90 newtons, 90 to 200 newtons, and 200 plus newtons of force. So if you get a reading of one of those figures, you can then correlate that to the most appropriate Interpod Flex product. And you can see it's even nicer that they're color coded. The low is green, and that replicates the green Flex product. You've got the orange or the amber, and then you've also got the red. And we will come on to the Flex range later on in the presentation. So the two clinical assessments I mentioned, the first here is the first metatarsal phalangeal joint dorsiflexion resistance test. Some of us may be aware of this clinical test, also known as Hubschin's maneuver, or also known as Jack's test. And both of those previously described have typically been done with your clinical hand. So it's a subjective assessment without objective data. The idea behind this test is to get an objective measure on the amount of force required to create a dorsiflexion moment at the first MTPJ. So it gives us an idea of how much dorsiflexion resistance is required. So how you perform this test, so this is a paper which explored the ins and outs of conducting this test. So you can see an explanation of it here, but just to run through it quickly, your participant would stand up straight, 2 feet, bipedal stance. There has been certainly criticism around all static clinical tests because they aren't functional dynamic tests, and that's correct. So we accept those limitations that when someone is standing there, it is not a true measure of the exact forces driving through the foot as what it would be when they're going through gait. But it's certainly better than no assessment at all. So with your patient standing still, looking ahead rather than down, so that doesn't influence their center of pressure and therefore the forces associated through the foot. You create a loop through the strap, which attaches to the force plate, and you wrap that under the big toe. So as you can see here, this is the force plate, and this is the strap, which is connected round under the toe and back up onto itself. And ultimately then, you apply a force, as the podiatrist, you apply a force perpendicular to the proximal phalanx to dorsiflex the first MTPJ. And you try and do this at a relatively constant speed. So then you hold the hallux once you have that elevated position, and you will get a reading from the force plate. You can then repeat this 5 times. So if you take 5 measures, get an average of those 5 scores, and you'll get your final score of how much force is required for the dorsiflexion resistance test. A second assessment that can be done is the supination resistance test, and this test uses the little plate that's associated with the Keystone device. So you've got the force plate sitting up here, that's attached to the nylon strap, and that comes under the middle of the foot to the lateral border and clips on to this base plate here. Again, for those of you that know how to use the supination resistance test manually, it's a similar way, only you're using a digital tool to create an objective measurement. And how you would perform this, so similar discussion as before, you'd get your patient standing up, looking ahead, bipedal stance. You would put the base plate on the lateral side of the foot, on the lateral border, and you would wrap that strap under the arch, under the navicular and the MLA area, and then pull the strap up on that medial side. And what you're trying to do here is create a vertical traction to create a supination moment and a supination force. You would take your measurement 5 times, take an average, and then you have that final data set and data point of how much force is required to create a supinatory effect on this foot. This paper published in 2021 is the work from a team who have explored the reliability of the Keystone device. And they have looked at the intra-rater reliability and the inter-rater reliability, which means if 10 different clinicians use the Keystone, how likely is it that they're going to get similar readings? And if I, as one clinician, use the Keystone device 10 times, how likely is it that I'm going to get similar readings every time? And you can see that both the intra and inter-rater reliability of the Keystone device for supination resistance test was good. And their conclusion is that the Keystone device is a reliable tool that can be used in clinical and research contexts. And prospective studies aiming to determine if the supination resistance test measures are actually predictive of musculoskeletal injuries is something that they are going to look to explore and recommend further research should be done in. So as a base point, we know this tool is reliable, both in clinical and research contexts. The next question is, what else can it do? What else can it help us predict? And is it reliable at predicting potential outcomes based on those differences of measures on the first MTPJ dorsiflexion resistance test and supination resistance test. So if you're not using these two tests as part of your clinical assessments for prescribing Interpod orthosis, I recommend you now start. If we also look at some further research, which was done as part of this PhD series, so this paper looked at the relationship between the supination resistance test, lower limb biomechanics, and the effects of foot orthosis on foot and ankle biomechanics, particularly looking at posterior tibial tendon dysfunction. So you can see the research question that they look to explore. Is supination resistance test, is it capable of predicting the effect of foot orthosis? Because we know that supination resistance test has been subject to a bit of scrutiny over the last few years. And their findings from the research, which is just very recently published, is that it is a highly reliable test. The results correlate with both midfoot sagittal and frontal angles and ankle frontal plane angles as well during gait in a population of PTTD. So if I explain that in a clinical sense, what that means is that the supination resistance test using the Keystone was given consistent results to give us an understanding of how the midfoot functions, both in sagittal and frontal planes, but also in terms of the ankle frontal plane moments as well in a case of PTTD. And what they found was that wearing foot orthosis did lead to reduced foot and ankle pronation moments, and that the supination resistance test was effective at predicting the foot orthosis effect on those ankle angles. So this is a really positive paper to support the use of supination resistance test and the use of the Keystone test, particularly in relation to using Interpod product range in relation to posterior tibial tendon dysfunction. We're now going to go through the orthotic library of Interpods. So we have a couple of certifications to highlight. Interpod range is ISO 9001 certified, which means as a product, they are maintaining effective quality management systems. They are also MHRA registered, which means they are compliant with UK medical device regulations. There are two key ranges within the Interpod product selection. The first range is the classic range, and the second range is the Force range. And I will go through them individually. So we'll start with the classic range. Well, no, we won't. We'll go through an overview of the range first. So Interpod Orthotics, it's basically a library of custom range of pre-made orthosis. The whole concept behind the Interpod range was designed to simplify the complexities of biomechanics by using off-the-shelf orthotic products. And these different products have been designed to improve patient outcomes and support your practice using a off-the-shelf device rather than a custom device. So within the product range, each product has been very thoughtfully designed, and the product range has different designs based on biomechanical, lab, and clinical experience. And the idea is for non-invasive, immediate research-supported treatment. And that's what this product range offers. So why would you choose Interpods over another product range? Well, ultimately, it has many advantages over orthotic manufacture, and particularly in the space of custom made. You can immediately fit them. You can see how the patient fits to them. You can see how they fit to the patient's shoe, and you can hear and feel how the patient responds to putting them in their shoe immediately and feeling the benefit or the differences that they get with it. We know the different levels of support that are in each product. So we have the product spec, we have the prescription variables that are in each. And therefore, if as a clinician, you know what you need to prescribe based on the pathology, based on the symptoms, and based on what you're trying to do, based on biomechanical theories and paradigms, then ultimately you can go and select a product from the range that's going to give you what you need. The other key benefit from them are that the fact that they are an off-the-shelf product, they are designed to fit well in footwear. They are designed as per shoe sizing and shoe width. So it makes fitting of the device a very, very simple and easy process, which makes it quick as well. And it completely eliminates any issue around lab errors, whether that's chairside lab modifications that you're doing as you as a clinician, or whether that is external lab errors that come with custom fit orthosis. There is no such thing as a lab error because they are ready to fit and prescribe out of the packet. What options have you got with the Interpod range? Well, you have full length options and 3/4 length options. You have a mixture of materials, so polypropylene, which comes under the Flex and the Vari-Force range. You've got polyurethane materials, which come in under the Soft and the Diabetic ranges. And you also have EVA options as well, which is the modular range. You have a mixture of arch heights ranging from 0, 4, 6, 8 degrees. And you also have a range of sizing options going from pediatrics, so children, all the way up to adult shoe sizing. So you're spoilt for choice, really. Let's look at the classic range then. So the first and probably most well-known Interpod of the range is the Interpod Flex. So these are from polypropylene material, and they come in 3 heights: low, moderate, and high. And you can see that the color code in here is the green, orange, and the red, which I previously alluded to in relation to the supination resistance test and the Keystone tool. What is the benefit and the features of the Interpod Flex range? Well, they come with many features built into them, which I'll show on the next slide. They come as a 3/4 length shell, and then you've got the option of an adhesive 3/4 length top cover, or an adhesive full length top cover. They're a shank independent device, which means they are pretty neat and easy to fit in footwear. They're very, very adaptable to all different types of footwear. They're very durable for the basis that they're polypropylene base. They last a long time and they hold their form and their function very well. The features of the Interpod Flex include the plantar fascia groove, which you can see as the slide points out, and this decreases arch irritation and helps to facilitate the windlass mechanism. It also has a plantar flexion of the first ray, which facilitates windlass function. And this is what facilitates sagittal plane function, which we spoke about as one of the earlier theories. You also have a cuboid notch, which is on the lateral side of the device, and that facilitates midfoot stability, particularly during the mid-stance phase. And then the other feature that you have is obviously the difference in arch heights between the low at 4 degrees, the moderate at 6 degrees, and the high at 8 degrees, which creates that supinatory effect. You can see here the correlation. So the arch height helps to support the hindfoot and the midfoot, and particularly along that medial column. So you can link, if you're not sure which one should I choose, the 4, the 6, or the 8 degrees, well, actually use your Keystone device, take a reading of the supination resistance test, and ultimately let the data help you decide, depending on the level of newtons, whether it's less than 90, you'll choose green, 90 to 180, you'll choose the orange, or 200, 220 plus, you're looking up into the high range in the red. Another product within this range is the Interpod Softs, and these are quite different to the Interpod Flex. mainly because of the material. So the Interpod Softs are made with polyurethane. So unlike the polypropylene, which is quite hard and firm, the polyurethane is quite soft. Other features and benefits are similar in the fact that they come in 3/4 length. They also come, excuse me, in full length. But these devices provide so much more shock absorbency and comfort because of the difference of material. The other point that's important to note is that they are a shank dependent device. So with the nature of the shape of this device and the material that's used, it is shank dependent, which means that the whole bottom side of the device does need to fit inside the shoe. Therefore, you need to be a little bit more mindful about the fit of these inside a shoe. And these may feel a little bit bulkier in some shoes compared to the Interpod Flex. So if you need to make a decision on what insole to prescribe based on the type of footwear that it's going into, you need to make a consideration on whether it would be an independent or dependent shank, as to which orthotic may be more suitable. The Interpod Soft range comes across the kids and adult size, and they are very durable. So albeit they're soft and they're cushioned and they provide shock absorbency, great for issues at the heel and the forefoot, which commonly are subject to lack of cushioning, lack of shock problems. They are also very durable and very easy to wipe and keep clean. You also have an Interpod Diabetic product, and this is similar in the fact that it's used and made and manufactured from polyurethane material. But where it differs quite significantly from the Interpod Soft is that it has a different material as a top cover. And this top cover material is used with Poron 96, and it is much, much softer to create a much more comfortable contact point with diabetic feet. This device is currently available in 6-degree wedging. It's shank dependent, and it is suitable to provide rear foot and midfoot support to redistribute plantar pressures. It is suitable to be used in patients with diabetes, and you can understand that by it being called an Interpod Diabetic. And the Poron 96 is really important for softness, and we talk about slow rebound. So for someone that's had problems or may have difficulties with their feet associated to diabetes, the softness of the Poron 96 really helps to protect the underside of the foot in that contact layer. And then you obviously have the benefit of the arch support as well. Another product within this range is the Interpod modular product. Again, a very, very popular product out there that lots of people enjoy and use. And these are made from EVA material. They cross over slightly with the Interpod Flex range in the fact that you can see the similarities here between the green, the orange, and the red coming back. The differences between the 4, the 6, and the 8-degree support. And the joy of the Interpod modular is you can adapt and tweak them. So depending on what reading you got for one foot and the other foot, you may be able to adapt and tweak to an individual patient and prescription. The EVA devices, they're very lightweight, and they do come as a 3/4 length, and they are only currently available in adult sizing. We'll now move on to the Force range, which is a newer range of the Interpod orthotic library. And what we have here is the Vari-Force range. So the Vari-Force range is a NeuroFlex polypropylene. So it's different to the traditional polypropylene of the Flex range in that the Vari-Force range has allowed and created stiffness variants in the material. So it kind of looks the same as the Flex. You can see it's a 3/4 length shell. You can see there on the pictures, it's got the plantar fascia groove, the first met cutout. You can see the features and the benefits. But where the key difference here with the Vari-Force range comes is the difference in material stiffness, which then allows you to alter and play with support, stiffness, and ultimately shock attenuation as well. It comes in the ranges that you've seen in the Flex range, the 4, 6, 8. So you do have an option to provide more supinatory force as well as more or less material stiffness force. So the Vari-Force is a wonderful product if you have more knowledge and understanding of forces and loads and stiffnesses. And if you're trying to influence that to more degree, then you can absolutely explore the Vari-Force range to get what you need. One of my personal favorites and clinical favorites is the Neutral Heel Cup within the Vari-Force range. So the last slide I mentioned that you've got a 4, a 6 and an 8 degree wedged Vari-Force device. You also have a 0 degree device, which means it's a neutral shell with a neutral heel cup. What is wonderful about this is it's just a great stabilizing, supportive device. It's got a deeper heel cup. It's got stability at the heel post. And you also still have the choice of the low stiffness or the high stiffness. All of the Vari-Force range is shank independent, which means, as I mentioned with the Flex range, they're very, very flexible with footwear. They're very easy to fit. They work very well with conventional everyday footwear. And these also come with the top full length cover as well. You don't have to use the top cover. You can just use the shell as it is. But if you want any extra comfort, any extra shock absorbency, you can get those features out of it, adding the extra top cover to it. Within this range, you also have the Slimtech product, and you can see similarities here. So these are also made with the NeuroFlex polypropylene. These are also available in 2 types of stiffnesses, the low stiffness and the high stiffness, replicated by the lighter and the darker greys. And you have 2 arch height options available here. So these are coming a 3 degree or a 4 degree. And you can see the shape of this shell in the Slimtech product is very narrow compared to either the Vari-Force or the Flex range. And the idea behind this is to be suitable for narrow or dress style of footwear. So it's a cobra style of shell to really narrow the shell to improve footwear fit, particularly with dressy footwear. You've heard me mention about the different EVA top covers, and with the Interpod range, depending on the different products, but you do get top covers available. They may be 3/4 length or they may be full length. Generally, they come as self-adhesive, so you can attach them to either the Vari-Force or the Flex range or the Slim range. And you can also get duplicates or replacements. So we talked about the longevity and the durability of the Interpod shells with the NeuroFlex or the standard polyprop. What you may find, what your users may find, is that the shell will last a lot longer than their top cover because they'll get years out of their shell. What you may find is the need for replacement top covers, and that is an option within the library that you can get a replacement top cover or a duplicate top cover as a standalone product. You can also get EVA additions as standalone products, and here you can see lateral pads, heel lifts, metatarsal pads, and these are all part of the Interpod library. And they are designed to be used in combination with the Interpod products. So should you require, based on clinical need, to provide any extra additions like what's on the slide, there are products available to help you further customize the Interpod device should you need to on fitting. So that gives us a synopsis of the Interpod orthotic library and the different products that fit within that range. And it leaves us with ultimately 5 questions, because you're wanting to use Interpods, you need to answer these questions. Which one do I use? Which one do I choose? Well, I would ask you to think about, what is the primary aim of your orthotic? Are you wanting to provide predominantly support and control? Or are you wanting to provide predominantly cushioning and shock absorbency? Immediately on the answer of that question, you will be laid down the path of which material is going to be more suitable, and therefore find your Interpod product to suit. Second question, what did your clinical assessments tell you? You've heard me talk about the first metatarsal phalangeal joint dorsiflexion resistance test, and you've also heard me talk about your supination resistance test. If you are considering an Interpod product and you're not sure which level of support to give, 0 degrees, 4 degrees, 6 degrees, 8 degrees, then use those clinical assessment findings with the Keystone device to guide your prescription. The next 2 questions, what foot type does the person have and what footwear will it be fitted to? That is to make sure that it all works together. It doesn't matter what insole you prescribe, it has to fit in a shoe in order to be effective and to be worn. So you do need to be mindful, if you're going to prescribe a specific product, is there enough room in the shoe for that? Does it fit well in the shoe? And will the foot get in on top of that as well? And the other consideration that you might factor in is, what are the actual weight and activity demands of this orthotic device? So is it a short-term measure or is it a long-term measure? Is someone going to be pounding 50 miles a week on this device, or are they going to do 5,000 steps a day? That'll give you an indication as to what material or what product might be suitable for that particular person. And when you're prescribing the devices, what I would recommend is that you always highlight the importance of a gradual transition period. We recommend using the devices for 1 to 2 hours initially, and then building up the device in 30-minute fragments. It can take someone or anybody up to 4 weeks to transition as a normal part of that process. And it's important that you highlight to the user why you're prescribing the device, what you're wanting them to achieve with the device, and how long you're expecting time to take to achieve those outcomes. We may be using them on a short-term basis, or it might be a longer-term treatment plan. And for the users, highlight to them what they are expecting. They should be comfortable, they should fit their shoes, and they should help with their symptoms. They shouldn't be grossly uncomfortable. They shouldn't be very difficult to wear. Particularly the joy of the Interpod range is that it is an off-the-shelf device. It should be comfortable, it should fit very easily, and they should be quite simple to transfer between shoes. Let your patient know how important it is to make sure they're in the right shoe. And also that the options are, if you're doing a longer term management plan, the options available for replacing top covers, if that's appropriate for the product that you've selected, or if they're replacing the device down the line as well. So thank you for listening to today's session on Interpod. I hope it has been enjoyable and informative. And if you have any questions, please do get in touch. Thank you for listening.